Hi, I talk about mast cell, mastocytosis, and related disorders. I study School Catholic University, Nursing School. My name is Mariana. Definition: mast cells which are present in most tissues mature in tissue from hematopoietic progenitor and occur unique feature of local effect cell. These features vary depending on the tissue microenvironment. This article provides a variety of recent development concerning the place, psychological pathology of mast cell. We discuss current diagnostic and therapeutic approach to mast cell disorder with an emphasis on mastocytosis. Application in nursing. It is important for patients with mastocytosis to avoid substances at the environment that may provoke mast cell activation. It is an acute anaphylactic episode occurs. It should be treated aggressively with intramuscular epinephrine adrenaline at a dose of 0.3 mg of 3 dose solution in adults and 0.01 mg per kilogram of body weight in children that not exceed a total dose of 0.3 mg.
Welcome to the Mastocytosis Society video on mast cell activation symptomatology. This video was funded by a generous grant from the lay organization of the American Academy of Allergy, Asthma, and Immunology. Hello, I'm Valerie Slee, Vice Chair of the Mastocytosis Society. I am also a patient who has had a systemic mast cell disorder for over 20 years. It is our hope that this video will help you to recognize the symptoms of mast cell activation in order to facilitate earlier diagnosis and more effective treatment of mast cell disorders. We present the expertise of 4 leading physicians in the study and treatment of these diseases. At times, these doctors will speak about the disease mastocytosis, as clearly defined by the World Health Organization. At other times, they'll speak about mast cell activation disorders, which fall outside the WHO criteria. We hope their expertise and their differing perspectives will contribute to your better understanding and to the diagnosis, treatment, and research into all mast cell disorders.
Mast presence of abnormal accumulation of mast cells in the tissues. Mast cells are integral parts of our immune system. We need them to fight off infections, but they are also involved in manifestations of symptoms of allergic diseases. They contain chemicals such as histamine and leukotrienes, and when they are activated, they release these chemicals into the blood circulation and into the tissues that brings on the symptoms of allergic diseases like flushing, itching, low blood pressure, and so on. And in mastocytosis, the bone marrow produces too many of these immune cells, and they get improperly activated. The patients often have problems with symptoms due to mast cell mediator release, such as unexplained flushing, itching, gastrointestinal symptoms, nausea, vomiting, and so on.
Pros and cons. Pros and cons. Pros. Most symptoms can be managed with histamine receptor antagonists or other drugs that interfere with mast cell mediators along with blocker of mast cell activation. Patients with aggressive mastocytosis may require additional cells. Cons. Data are beginning to identify reliable biomarker of mast cell activation synaptic step-through which many triggers converse drugs with dual inhibitory activity against mast cells.
My name is Kelly Foster. I am the pediatric co-chair for the Mastocytosis Society. My daughter suffers from a rare disease called mastocytosis, and then we just found out 2 years ago I have another variation of the same disease, mine called MCAD, mast cell activation disorder. And what it is, it's the mast cells within our body, what we all have. With Brooks and the mastocytosis, she has either too many or they're abnormal shaped. Mine, I just have normal shape, normal amount, but they just trigger for unknown reasons. When our mast cells degranulate, they release chemicals such as leukotrienes, tryptase, histamines, prostaglandins, and then it causes rashes, fainting, blood pressure dropping, anaphylaxis. It's very uncomfortable, and the quality of daily living is greatly affected.
So in Ecuador, we will also suggest that systematic mastocytosis should be considered in patients in one perioperative anaphylaxis develops, particularly in patients who have repeat episodes and to have received structurally oral drugs. Indeed, drugs triggers are estimated to account for 5 to 25% of cases of anaphylaxis in patients with systemic mastocytosis. Conclusion: pathologic conditions involving muscle appear to be more common than one thought. Diagnosis and treatment of such disorders are changing if potent symptoms and the presence of coexisting conditions. In patients with severe symptoms of those with allergy to immunotherapy, the investigation muscle motor monoclonality may provide the diagnosis. Identification and avoidance of triggers, including emotional or physical stress, may be helpful.
Mastocytosis, mast cell activation syndrome, or something that looks a lot like the other two but hasn't been diagnosed. Does it matter whether you know which is your diagnosis? I'm Nancy Gould. I have indolent systemic mastocytosis, and I'm interested in this constellation of disorders that look confusingly alike. We need a better understanding of them in order to help so many people who need a diagnosis and appropriate treatment. The diagnosis of mastocytosis is made using clear and objective criteria. It is not a diagnosis of exclusion. If a person fits the World Health Organization criteria for mastocytosis, then they have mastocytosis. If they don't fit the criteria, they don't have mastocytosis. Mast cell activation syndrome is currently being defined and criteria are being agreed by international mast cell specialists. If a person fits these criteria, they will be reasonably certain that the unwanted activation of mast cells is the source of their symptoms. Of course, the next step is to determine what's causing this mast cell activation. So the diagnosis is a midpoint, a stepping stone to further understanding and better treatment of their disorder. So, mastocytosis or mast cell activation syndrome, or something that looks similar but hasn't been identified. Which one? Why bother with a specific diagnosis? Let's look at a rather simplistic example. Suppose you discover you have a kidney stone. Will you hope to find useful information from other people with kidney stones? Or will you look for information among people with gallstones? Both disorders involve unwanted stone formation, and in both cases the stone may cause severe pain. So perhaps management of the pain could be usefully discussed with both sets of people. But to understand your situation and get an idea of treatment beyond the pain, the experiences of people who, like you, have had kidney stones would more likely be informative to you, right? Similarly, anyone with symptoms that look like they are caused by the release of mast cell chemicals might be able to make useful day-to-day management suggestions to anyone else with a similar set of symptoms. If a person wants to get a better understanding of their disease and how it may change over time, though, they would be more likely to benefit from discussions with people whose disease is as much like theirs as possible. People with indolent systemic mastocytosis, for example, will get a better feel for how their disease may change over time if they compare notes with others who have indolent systemic mastocytosis, rather than others with perhaps aggressive mastocytosis, or people with non-mastocytosis disorders of mast cell activation. Why do I say this? Well, people with mastocytosis have an increased number of abnormal mast cells, a clone of abnormal mast cells. It is the abnormality that leads to their overactivity and makes the diagnosis. People with mast cell activation syndrome have a normal number of mast cells without the mastocytosis abnormalities, and for reasons we don't yet understand, their mast cells release enough chemicals to cause symptoms. The only similarity between these two diseases is the presence of symptoms due to mast cell mediator release. We wouldn't expect the disease process to play out in the same way in both groups. The presence of a clone of abnormal mast cells in one group suggests a certain set of expectations for the future progress of the disease. The normal number of mast cells without the abnormality in the other group suggests a much wider set of possibilities as their disorder changes over time. Each person in a support group misses a golden opportunity to make progress in understanding their disease if they or others in their group fail to acknowledge their correct diagnosis when discussing how their disease has affected them over time. Important observations that may be of interest to researchers cannot arise if a miscellaneous assortment of diseases is present among the people in the group, and if each person isn't clear about their diagnosis. So, does it matter what your correct diagnosis is? Mastocytosis? Mast cell activation syndrome? Similar symptoms as yet undiagnosed? Yes, of course it does.
Thank you.